Thank you, Gail, and thank you for your service over this trying time for all. Good afternoon. Today is Election Day. It may seem like a strange time to make an announcement with regards to COVID-19 mitigation, but during this time of uncertainty that the virus has thrust upon us, it is the perfect day to make such an announcement. Nothing has impacted our lives more and created such divisiveness as this invisible virus that spreads faster and is deadlier than the flu. Making this joint announcement as the top elected officials of our county and our city from different political parties illustrates the importance of all of us working to mitigate the coronavirus impact together. So no one can say, you made this announcement because of the upcoming election or because who got elected. Instead, what we all should be saying is we made this announcement because we are in a public health crisis. And the only way we can reduce the public health harm across our city, our county, our region, our state, and our country is by being responsible, being respectful, and caring for the well-being of our family, friends, neighbors, and our community. Thanks to Governor Pritzker's decisive actions earlier this year, not only were lives saved, but people were saved from going hungry and homeless. The fact of the matter is that we were able to expeditiously bend the COVID-19 curve so we did not experience the bell curve like other states did. Consequently, with the rise cases throughout our region that's displayed back here, we know that the first wave is coming. Unlike earlier in the year, today we have better information and know the importance of data. That is one of the reasons Springfield was the first city in the state of Illinois to restrict and enforce open spaces in bars and restaurants to avoid congregating back in August. Since the governor's emergency order was issued Thursday, we have been working to determine how best to protect everyone we serve from the devastating impact of COVID-19. The three unrefutable ways to prevent the spread of the virus are the 3 W's. Wear a mask properly over your nose and mouth, watch your social distance at least 6 feet apart, and wash your hands often. I personally knew individuals who died from the coronavirus because we are tracking those cases closely. However, I also know people who died from the impact of the virus, those who delayed seeking medical help they needed, but we do not track and measure those lives. It is with pure intentions that we move forward with our numbers down. Separately, the city is working to enhance the current mask requirements. Medical advice shows, and the data, that all of us adhere to these measures regardless of your beliefs. It is the morally right thing to do. Every person should wear a mask for health of our community. Whether you wear a mask for your loved ones or to ensure the server at your favorite restaurant stays employed and can keep food on their family's table, wear a mask. Wearing a mask is not at the detriment of one person or population. Wearing a mask shows you care for the health and progress of our entire community. Yes, we have seen an uptick in cases. One of the main causes in these escalations is house parties. People having their friends over for football or to celebrate a birthday, unmasked and not socially distant. But the virus doesn't know who is a friend or a stranger is. The virus spreads to person, infecting children, adults, and the elderly. That is why I'm asking for the month of November that all house parties stop immediately. Coming up, we should be thankful for the health of our family and for our job. It is incumbent upon each and every one of us to do what we can so our entire community is healthy and employed. We need to think about the health and well-being of our neighbors. That is why I want to reiterate, no house parties. If you gather with anyone who lives outside your home, mask up. It is that simple. You may think it is uncomfortable, but we can guarantee that the virus is no worse. Schools being closed is worse. Businesses shuttering forever is worse. We need to change the trajectory, decrease the infection rate, take the stress off our hospitals, and mitigate the coronavirus impact on our residents, especially our businesses. It is not solely the city's job or the county's to stop the spread. It is not solely the county's job or the state's throughout our region to stop the spread. It is all of our jobs to stop the spread as residents of Springfield, this county, this region, and our states. We need to do our part together. This time I'd like to introduce Chairman Andy Van Meter and thank him for his leadership through this trying time.
Thanks, Jim. I want to stress, first of all, that we are totally in support of the governor's order. And we are following the framework of that order, but we are taking a phased approach to the implementation of that order. We discussed the situation with our medical advisors, and they felt that it was acceptable to try to an additional mitigation to get the community's positive test numbers down and try to retain operability of our hard-pressed restaurants. Our approach is a 2-week time frame to try to get our numbers down and preserve our local restaurants. We're trying restaurants and get the numbers down within the framework of the governor's orders. And we fully understand that if we fail in this effort, additional mitigation will be implemented swiftly. I want to introduce the sheriff, who's going to talk a little bit about our releasing of the new regulations.
Thank you, Chairman. Good afternoon. We're here today asking for help from everyone in Sangamon County. We have been informed by the Sangamon County Board of Health and the Sangamon County Department of Public Health that the COVID-19 positivity rate is currently higher than it was in the spring and early summer. That means we have to change our habits. I know that there are people that disagree with how officials have come to these conclusions. I'm not here to discuss that, nor to disagree with you. I'm here as a responsible elected official that must try to help everyone. We know the physical, mental, and economic suffering our friends and relatives have gone through. Citizens get sick, and our businesses shut down because we didn't try hard enough. We have received orders from one branch of government that requires tough mitigation efforts from all of us. And though I would prefer our legislature have a say on this also, this order does have legal. If we don't work together to flatten the curve again, we will all be required to go back to conditions that none of us want. We are asking you to invest in yourselves and invest in the safety of the people of Sangamon County. In an effort to bring down those numbers, you, as a business owner, patrons of these businesses, first of all, we, lives back to normal as soon as possible, must follow the simple steps of wearing a mask, socially distancing, and as possible. Our health fullest effort weeks and get back on the track of recovery. At the end of these 2 weeks, our healthcare experts will analyze where we stand and we will seek their advice. At that time, it is possible that in order to protect our citizens, we take a more aggressive position in the enforcement of the county ordinance that seeks to mitigate the virus. And I'd like to introduce Chief Winslow from the City Police Department.
Good afternoon. What you heard here today is that we can't do this alone. We have to do this together. It can't just be law enforcement. It can't just be the elected officials. we have to take responsibility for our own individual decisions and behavior out there. We have to all do our part so our neighbors, our friends, our local businesses can survive. And ready to enforce these new, we have been out over the last month, Executive Order number 6. We will continue to do that. We conducted 84 compliance, basically Saturday around 2 p.m. till Monday morning. Out of that, we cited 1 establishment. So with that said, a lot of our out there, but we're strategizing even further. It's not just going to be restaurants and bars. It's going to be our retail establishments. It's going to be our convenience stores. Everybody has to do their part. Just from a public health world, it's not just a town as a city to get out from under these additional mitigation factors. So again, we're here to do our part, and we'll do our part properly. Thank you.
Does anybody have any?
Yep, I got one. Follow up if I could. Is there anybody from the health department? Medical degree? Okay. My follow-up question is, why isn't there somebody with a medical degree? And if we had been taking these enforcement measures earlier, pursuant measures, handing out tickets, would we be where we're at today?
Our medical consultants had a press conference last Sunday to try to introduce the concern that we had about what we've been experiencing in the hospitals with increased patient loads there and exhausted staff. They presented a lot of the information. We continue and have since March to meet with them every morning. We started going to let Wednesdays be off, but they have been, we've had no less than 3 meetings with them since yesterday. We consult with them on every decision that was made in this effort.
But they're not here today for us to ask questions.
But not today. If we need them here, we'll bring them in.
Just not to sound blunt, but you all think you know better than the state and the public health experts at IDPH that put in place the mitigations.
Well, for the same reasons that we know that the mitigations are a good idea. We're trying to figure out what's best for our community. If it doesn't turn around, we're going to, actually in some ways, these are a little stricter than some of the guidelines that the governor could put in place.
Well, why don't you just do exactly what the governor said?
Part of it has to do with the ability to enforce, and I'll let you guys do it.
Personally, I've been following this for a long time. I don't have a medical degree. And what needs to happen is more consistent, proactive measures, so we all know what the action steps are. You're doing it. It's proven to be the #1 case. When we were on a call yesterday with the medical providers, you can call Dr. Graham, he can explain it. When we talked about, he had said, there's a study that showed that counties that enforced the mask requirement mitigated by 50% with regards to the virus. That does stop the spread. Now, when we were on the call with the state of Illinois, when they announced the, Thursday was the announcement of Region 3. And here's the challenge for any mayor. It doesn't matter if you're in Illinois or any state or throughout the country. The way we're structured is by region. So we could be all-stars, we could clamp down on everything. That won't matter if other parts of the region don't comply. So the stress is on the hospitals. That's the driving factor. That's always been the driving factor for myself. I have relatives in the hospitals. I have a niece that's in the ER, HSHS. I have family members over at the Memorial. And so I know the significance of it. And I know the significance of the other side that's not measured. And that's by a waitress that reached out to me. She has a 5-year-old son that's April, May. She said she's not gonna make it through. So, we have a homeless population as it is. We have a food situation as it is. And we are impacting people's health on both sides. So what's the proper action to take? Nobody knows. The proper action to take is to be proactive with regards to masking. That's a definite. We know we can pick up the germs right here in this room. We can pick it up opening up a car door or a handle of a house or anything. So nobody knows. So that's the proper mitigations we all can take. The other thing we do know is how divisive this virus is. That's why we decided to do the announcement today. So nobody can say, oh, it's because of the election, that's why you're taking these actions. Or we wait a day and they say, oh, it's because so-and-so got elected. No, we had this announcement today because it's the right thing to do. We need to pull our community together, our region together, our state together, and our country together. But for us, in Springfield, being a regional provider, we have great healthcare facilities. It's just not our region. Memorial and HSHS, they have a broader service area than our region. So they are bringing individuals from their service area, right from the region, but that fills that capacity level. So it just doesn't end here for us. As Director O'Neill had said, we intend to take it a step further. I've been in communications with the Illinois Municipal League, and we are going to measure what we've done, and that's what it's all about. The actions you take, how does it impact people's lives? How does it change the curve? That's what's the important thing of the data. Everybody said, this is the second wave. No, this is our first wave. You know why? Because our first wave didn't really have it. It's flat. That's because we took actions and flattened. What we do not want out in the public is people that have gotten sick and said, oh, well, wasn't that bad? Well, it depends on the person. It's been devastating. People have died from it. The other part of it is, we went through the first wave already. We're not going to shut it through. Coming right now, you can see it. This is our first wave. And you can question the state of Illinois' data. You can question here. But I know for a fact, when I was on the Bloomberg Harvard Initiative, they pointed that out to me. This was about a month or so ago. They said, Mayor, did you know you didn't hit the curve yet? I said, what? Because you didn't hit the curve. They showed me what's shown here. Just a flat line. We had a blip. That's because of our mitigating factor. The most stringent mitigating factor is the washing your hands, keeping your distance. The other thing is, restaurants have been targeted. Restaurants has been pointed out to being a spread locator, as well as bars. And the reason being is when you do your contact tracing, and County Public Health can speak to this, how many of you have been to a restaurant in the past 2 weeks? How many have been out to other locations? That's how you track that. But that doesn't mean you picked it up in a spread, or you didn't pick it up there necessarily. But we do know there are outbreaks. And that's what we'll be speaking out. When there's an outbreak, a significant outbreak, take immediate action. It's just like fire departments back here. When a house is burning, you put the fire out at that house. You don't allow it to spread. That's the same thing here. So we're taking a look at many different areas. We're trying to gather as much information so we mitigate the impact of people's public health across the board.
To be specific, Mayor, what data was used to come to these mitigation measures? What specific?
And speak to that, or Neil speak to that with regards to the patients with the professionals.
Yes, best with the data, yeah.
From our data, which is a couple of dates set use their data, which we were far apart, we're very close, just by on the days is within a couple days of their all of the things that we're looking for, which is a positivity rate and hospitalization, people who go to the emergency department with COVID-like illnesses, the number of deaths we've had, the number of new cases, total testing done. That's all generated from the best resources at the time at the State Department of Public Health and their laboratories. So they use that for the mitigations.
Sure. You're right, I mean, the curve has been low. That's when we took mitigation, and now when we wanna do the same things that we know prove successful, we don't wanna do it anymore, and a lot of folks are gonna say, why don't you go with what you know works? I mean, I'll use this one room for example, there's 24 people here. Is this the wise way to get, why couldn't this have been done via Zoom or something? Are we just not, is this just not sinking in that when folks get in close proximity to each other, that germs can spread, be it at a restaurant or a bar or this room or a city council chamber or the White House Rose Garden?
Well, you have to look at the facts. I know one of the facts are, people said when schools open, there'd be, spread. Some schools have been able to open and mitigate that. I'm just gonna ask, these are people that call me. So let's go back to April. That's why we're taking a look at things. When Chief said, we're taking a look at mitigating factors, it's just, like I said, Springfield was the first city. We went steps before the state of Illinois did, but based on the information that we received, or just being congregant and say, talking to one another on a regular basis for like 10, 15 minutes, who knows? So we enforced that. We were the first city to do that before the state did, because we knew that was a proactive measure. So we are measuring based on the advice of medical professionals. They looked at information based on the mitigating factors that we're adopting, which pretty much is in line with what the governor has put in place. The one disagreement point is with indoor dining. And so with regards to that 5% capacity, when we were supposed to take mitigating factors, it was, I believe, and anybody can correct me, I believe, I've been told it was 50 and then go down to 25 and then 0. But it went from 50. And so for Springfield, we could be hitting the metrics and maybe go back to 25, but everyone in that same boat together, down back to 0. So we believe, we're 2 weeks. We're going to have strict enforcement. We are going to look at a stronger mask requirement. And now I'm only speaking for the city of Springfield on the mask requirement part, and moving in that direction. I think that will have greater impact. But the other side of the equation is we can all second guess. I mean, that's the aggravating or destructive nature of this virus. Divisiveness is there's so many second guesses happening. And really, we should be all moving in the same direction. Hopefully after this election is over, we can move that direction. I think this news conference today points to that fact. How do we move forward together, moving that direction? But it's based on, you have to take proactive actions, and that's what we intend to do, and based on the information we have to stop the spread. But here's the messaging. Here's the messaging. It's each and every person. It's not up to the governor, the state of Illinois, or we all have to do it together, because it won't matter. And I've had conversations with mayors across the state. I've heard from counties. They're going along with the governor's orders. They're not going to enforce. Plain and simple. There's some out there not going to enforce. So we could do, we could go along with it, turn a blind eye to it. We choose not to. What we choose to do is to raise the level of expectation for each and every person in our community. But it's just not Springfield. It's just not Sangamon County, because we're going to do our part, and we are going to challenge the counties throughout our region and throughout the state to do the same, because it doesn't help us in Springfield in hitting our metrics if other counties within our region and within the service levels of HSHS, Memorial Hospital, if they're not doing their part, we're gonna be locked in with those metrics just because we're impacted by other areas surrounding us.
Mayor, you talked about the enforcement of it when the rules are different between the city, the city and the county.
Or you can go out there and practically patrol?
Well, it's going to be both. We've always responded to complaints from these businesses. In addition, the city and the county both have been doing spot checks in the businesses. But we also know that the more often we do it, the more voluntary compliance we're gonna get. And that's what you're gonna see is an increase in these spot checks. Instead of just maybe doing it on the weekends, you're gonna see it every night. Instead of maybe doing it for an hour, we may do it for half the shift depending on our manpower. But you know, this is also balancing out these business owners that need to make a living. You know, you're all here, you come to work every day. If you shut down those businesses, they have nothing to do. They have no livelihood. You know, we need to consider their mental health. You know, the depression rates, the suicide rates, the drug overdoses, alcoholism. There's a lot of factors that come into play here that we have to balance that all out. But you're gonna see just a little stepped up enforcement to help bring these numbers down so that people can stay open. And that will be our message to them, is to encourage the voluntary compliance that we really demand out of them, and we're gonna keep working on that together.
What about ticketing individuals instead of just businesses? I mean, businesses feel picked upon because they're expecting you folks to do that. We've all been around Springfield. We've seen for months that folks aren't following the rules. And so you haven't been enforcing the rules as strictly as you can. And now you seem to be saying that you will, because the state is saying, okay, we're gonna play tough. Why should anybody believe you're gonna follow the rules, enforce this any more strictly than you have in the past?
I don't disagree with you when you say, what about the individuals? They are the ones responsible, but the business owners are the ones that control who comes into that business. If somebody's not complying, and then they refuse to comply, that's when they call law enforcement, and now they're trespassing as far as we're concerned. We will remove them for that reason. So we don't want the businesses to be unnecessarily negatively impacted by an individual that refuses to comply, but if the business doesn't force them to comply, then that's when it comes back on them.
Jack, I'm saying spot check them. You can go to any given Walmart and see folks that are flouting the law. Why should the business have to call? I mean, you don't wait for the businesses to call to say, please enforce the underage alcohol buying on underage tobacco. You go out and proactively enforce it. Why hasn't it been done here? And why should we believe that it's going to be any different than it has been in the past?
Well, I don't know if you know how many license holders there are in Sangamon County, Springfield, but we don't have enough manpower to cover all these. So that's why we do random spot checks and then check the complaints.
And I think Dan can answer about the authority, we have the authority to do it with the businesses.
The legal landscape in respect to enforcement of mitigation protocols has become increasingly complicated since the shutdown in early last spring. And so there have been various efforts to increase enforceability of mitigation measures. And I'll just try to break down the legal landscape for you very briefly and concisely. We have the Public Health Act, which of course has very specific standards that must be met for isolation, quarantine, or closure of a business. And those standards are very clear in the Public Health Act and the Control of Communicable Diseases Code. So when I talk in terms of a legal mechanism to enforce, the Public Health Act has that. We saw the governor presented rules in May to the Joint Commission on Administrative Rules, the Joint Committee on Administrative Rules. Those were not approved, so those did not then have the force of law. Other rules were submitted, an emergency amendment was submitted by the governor through JCAR in August. That was approved. And so we have a Class A misdemeanor that can be filed, and I will certainly enforce that. It is a law that can be enforced. And there's a Class A misdemeanor penalty. So that's the mechanism of enforcement for what we call the JCAR rule, which in summary was a prohibition on capacity and masks in of course, in the JCAR rule is against the business, not enforceable against. The other mechanism for enforcement is local ordinances, and that's what you've seen on a local level, implementing a mechanism for enforcement, a penalty, and that's what you're seeing here, and that's what we will continue to aggressively enforce.
Isn't this a dangerous experiment, this 2 weeks? Or if it works in 2 weeks, that's great, we can continue on as we have been, but if it doesn't work, then you're talking about stepping up enforcement. Well, then we have 2 weeks where more virus is spreading, more people are getting sick, more people are being hospitalized, more people are dying. How is that a good idea?
Well, this is not a TV movie where people are dropping dead at their desks. We are careful, the medical professionals are monitoring now. The experiment's over, and we immediately go into the full mitigation. So we'll respond immediately if we see that we're not having success.
Isn't that chart
this time and preserve the operation of our local restaurants.
You talked about why you decided to make this announcement today, but we've known that this trend is happening for a while now. We've known for months that it was possible. I'd like to know more specifics on when the plan was finalized, and can you be specific about what doctors supported it, not just consulted on it, but what doctors support this plan?
Well, our three consultants are Dr. Sandreessen, Dr. Miller, and Dr. Graham. And the additional mitigation conversation has been going on for some time, but for several weeks. In fact, I would say almost daily when the doctors need to review the numbers, they begin to talk about what additional mitigation steps we can take. So that's kind of an ongoing conversation.
Follow up to that 2-week question. Who makes that decision? What are the requirements for that? And is Springfield completely on their own? If the governor rolls back mitigations even more because the cases go up, are you going to roll those back? If the governor pushes forward, are you going to push forward? Who decides? How do you decide?
Well, we believe we are acting in concert. We're fully supportive of the governor's order. We are just implementing it in a phased approach. And to answer your question about who's going to decide if we're failing, our medical advisors, they review the numbers daily in consultation with our director of public health. They review the numbers daily, and if we reach a 12% positivity rate, or if the hospital, the excess capacity in the ICUs at the hospitals is less than 20%, we failed, and we immediately go into the full mitigation.
The governor's plan says that if you remain above 8% for 2 straight weeks, the mitigations would go even further into effect, maybe taking out elective procedures at hospitals. But you're saying we need 12% to see more mitigations here in the county and in the city?
That was the suggestion from our medical advisors. That is the criteria that we would use to end the phased approach and go immediately into the full.
So in 2 weeks, if we stay above 8% and the governor puts tier 2 mitigations onto region 3, the city and the county will just move to what tier 1 was, or will they move directly to tier 2 if it stays above that 8?
The question is, I think there's so many different variables, it's hard to answer that question. If the whole region is going into another phase, they're likely to see a lot of changes in our region, in our county as well, and we have to react to that at the time.
You're calling on everybody in the region to be consistent and to put in the same mitigation efforts, and yet the mitigation efforts that are coming from the state, you're saying, no, we're going to wait 2 weeks and try our own thing. Isn't that the opposite of what you're telling the rest of the region to do in order to continue on?
Our focus is on adopting rules as our phased approach to the implementation of the governor's rule, and in an effort to preserve the operation of our local restaurants. That's as far as I can speak.
How much of the number is going to have to come?
If I could, real quick on that. This all comes down to the enforceability factor. We've been sued, we've taken steps way back when. We've been sued, and we upheld in court because we put in place the practices and the processes that we could defend. And that's what we are doing right now. What can we do? What can we carry out? And be upfront, be transparent with the public. So again, I'll go back to, there's other cities here say, oh yeah, we're going to adhere to it. You're not going to force. So what's that do to us? That's not going to break that curve. What breaks the curve is everybody wearing their mask. So tomorrow night, we are having a special city council meeting. We'll have this discussion, and that's one of the topics. What's the council willing to do? Because it will take action of the city council, because we have to put those measures in place. And so that's what we intend to do, is talk about these. How can we move forward? Because quite frankly, 2 weeks from now, if we went along with the governor's orders, that's not going to change anything. In my opinion, that's not going to change where we need to be. Where we need to be, and everybody can play second guessing all they want. Where we need to be is go to the heart of the matter, and the only proven factors right now to mitigate the spread are wearing the mask, social distancing, washing your hands as much as possible. Now, some people are doing it, others aren't. And everybody keeps bringing up restaurants and bars. Do you know what the #1 spreader is? House parties. That's one of the main drivers, are the house parties. So what do we, and you heard the governor, I think just a couple weeks ago, pleading for everybody, during this holiday season, try to restrict as much as possible family gatherings. And all of you know how hard that is for our family. We've been doing this for 6 months. I do not have my brothers and sisters into my own house. That's devastating for any family. And you don't think I take personally when someone passes away? I knew someone passed away from the coronavirus. A vibrant person. I worked with her in banking. She could not have anybody visit her. She died a lonely death. That's unconscionable. What's more unconscionable, or as unconscionable, is the numbers we do not track. Sheriff brought it up. I have no idea what the depression rate is, the suicide rate, the addictions going on. That's the impact all our actions have for tomorrow. And that's what we take very seriously. And the only way that we know for sure to drive the numbers down is to get everybody on the same page with those mitigating factors of wearing the mask, washing hands, keeping that social distance. And we need to start tracking the other information of the others that are impacted by the virus from what's happening beyond us. And so that's why I'm glad this election is going to be over, because now we can hopefully get everybody on the same page. But this isn't just Springfield, this isn't just the county, this isn't just the state of Illinois, this is happening across our country. I've been on conversations with mayors through the U.S. Conference of Mayors. This is going on, the divisive nature of it, and through Harvard and Bloomberg and all those initiatives, it's the same thing. This is a war where everybody gets together and has agreement, here's where we're going. That's not the case, it's so divisive. But what should be real is the impact it's having on people's lives. And it's not just the ones impacted by the virus that get the virus, that's very serious, but I know on the other side of the equation, individuals that did not get help when they needed it. And that had the same dire consequences.
Mayor, I'm going to read you a quote quickly from the Memorial paper. Bars and restaurants represent a high-risk transmission area, just like weddings do, just like backyard gatherings that so many people had this weekend on Halloween. All of that stuff has to stop. Why is he wrong? Why is now the time to slow step mitigations when the trend is very clear? What we've been doing has not been working.
Well, on that, I would say we know that the mask works, right? What do I say to the waitress that reached out to me, raising her 5-year-old son, that they won't know where the next paycheck is to put food on the table? Or are they, they won't be affected, I guess. I don't know what their situation is. What about the gentleman that is a sole proprietor business? Won't be able to survive. He supports his wife in a retirement facility. He won't be able to pay that bill. And he won't be able to pay his house payment, things of that nature. So it has consequences across the board. We do not take this lightly by any stretch. If I want to be politically correct, you know what I do? I do just like other cities are doing. I just say, oh yeah, we're going to enforce. But I think we can do better. And we intend to do better. We intend to carry out what the governor wants all of us. We all have the same goal, to have the least amount of impact on our public. And that's what we intend to do. What we have to do is make sure the enforceability, the legality of it, what we can carry out, we're taxing our resources, and we intend to do that. But it has dire consequences across the board. I know everybody's focused in on the virus and everything else. It has dire consequences health-wise on the other side of it. So I'm not the medical expert, but really it has to take a look at all the information associated with that, because there are consequences health-wise on the other side. And I think by taking these proactive steps, we'll be second-guessed throughout, you know, but the bottom line is, with our area, just so everybody knows, our closing, there's no way out because of the way the metrics are designed. There's no way out to those businesses. So for what we're trying to do is, how do we make sure that we have least amount of impact health-wise for everybody? Because it's just not the virus, it's the public health stress, and it's the public health emotional stress of it, medical illness of it that goes along with it.
Sir, isn't it the virus? I mean, that's what's getting people sick. And to be intellectually honest about this, is it fair to say that we're gonna take this 2-week experiment knowing that people might die? We don't know, as you say, what the future might hold. But aren't we taking a risk and saying, in exchange for economic benefits or to help other folks, we're taking a risk that people will die of the virus?
Well, I guess each person can answer that. I don't view this as an experiment at all. I view this as that we're taking proactive steps to protect our public. Because nobody is tracking the other side of the equation. The other side of the equation, I guess, Chief, how has gun violence gone up this year? I don't know about drug addiction or drinking. Has that all gone up this year?
We don't track just people who drink.
Yeah. What about mental health? I know for the fire chief, I don't know if Brandon Blau, if they track this, but he says he's seen an alarming number of stress-related illnesses, heart attacks, things of that nature that they typically don't see. So that's the unmeasurable things that aren't happening, that we do need to measure, because our actions have consequences on both sides.
Mayor, you called them proactive steps. I mean, this playbook has been out since the summer that this is what would happen if we hit these numbers. Why not put these kind of these compromise mitigations into place before we hit the 8% over 3 days mark?
Well, I guess the chairman can speak to that with regards to the data and the information. There's questions on how everything is collected. And that's been the frustration expressed by other mayors throughout the state with regards to that. But the bottom line is, we can second guess this all day. But again, we hope that the media takes with them. This is everybody's responsibilities. It's just not the bars and the restaurants. It's just not us as elected officials. It's all of us. What can we do to stop the spread, wherever you live in, wherever community you're in? And we know for a fact, scientific method, wear your mask. That's a scientific proven method. So whether you agree with that or not, everybody should be in the same boat. And that's what we're trying to do. I think everybody going along blindly and saying, oh yes, we're going to adhere to the governor's order with no intent to do that, I think that is truly doing a disservice. And it's going to be catastrophic in the end. What we're trying to do is raise the level of expectations for each and every person that we serve.
How much does the number have to come down to avoid more restrictions?
What's that?
How much do the numbers have to come down to avoid more restrictions?
I don't know. Want to speak to that? Originally, what was supposed to happen, I guess I'll ask anybody, or maybe in the media, originally this was supposed to go from 50%, 25% to 0, but we've gone from 50 to 0. And again, it's about impacting people's lives. So, and once again, we're supportive of the governor's efforts. We all agree. What we want to do is try to get to that point where we can make sure that we do hit those metrics with regards to mitigation. And again, with the hospitals, I know as well as anybody the significance of our area. I mean, they serve their regional provider of healthcare services, and that's what they're doing right now. And that's the strain they're under. So it doesn't matter. We can, like I said, we can be proactive. We are being proactive, but we can do everything possible. We can drive our numbers way down, but we could lose out to the metrics because of the rest of the region we're serving or the service area. And that's all a factor in what we're trying to do. So the important thing is not only the actions we're taking today, but the actions that we're going to ask others to take that can help drive that number further down.
We got into this level of mitigation because we had 3 days consecutively of greater than 8% positivity, and we are currently around 9% positivity. We think if we drop it back below 8% positivity, we have a case to make for the governor that we deserve to be back in the previous designation.
Mr. Mayor, about how people should not be doing house parties. And under just a quick reading of the new order, up to 10 people are allowed at the same table at a restaurant. Obviously, at restaurants, bars, you are taking off your masks at times. So I'm just wondering, how is that different? You know, if I'm getting together with, say, parents who don't live with me and I don't generally see, but we're sitting together at a table for 5 at a bar or restaurant, how is that different than a house gathering?
I'm glad you asked that. We just had this conversation right before this. And actually, I'm a firm believer in six chairs per table. The governor's order says 10. So I'd like to go more stringent. You know, the fact of the matter, I think that let's do the timeline. Thursday was the governor's announcement. Friday, we were trying to regroup, see what we can do legally. We're supposed to enforce at midnight, I think, on Saturday with the clocks winding back down. You know, that was hyper speed when it comes to government. But we're taking a look at all of that. But we're not done. We're going to continue to look at those mitigating factors. What we wanted to do is come to a consensus agreement because, you know, we thought that'd be the best approach. But again, I think Dan Wright had pointed that out. We can do things, but it's going to take city council action to do certain things. And that's what the special meeting is about tomorrow night.